Excellent. So it looks like we've got everyone here. Welcome. I'm Dr. Rosalie, and we've got Dr. Mary here today as well. Dr. Molly is recovering from some eye surgery, so she is unable to make it today. But we shall proceed without her. So our doc talk today is on blood sugar control and weight optimization. And here at Prosper Natural Health, we are a team of 3 clinicians, 3 naturopathic physicians here, and we do team care all together. So, when one of the docs is unavailable to see the patient they usually interact with, the other docs sort of take over. And essentially, you get 3 brains in one visit, ultimately, since we talk every week about patients in our grand rounds. And most of you already know this. So outline for today in terms of what we'll go through is when it comes to blood sugar control. First, we'd like to introduce a bit of the physiology of it. Which are the organs that are important for blood sugar control? What are the hormones that are involved in appetite regulation and satiety? Then we'll talk through diagnoses. What are some various diagnoses? There's several. We'll follow that with lab testing that we do that can sort of optimize what our blood sugar is. And then we'll run through 8 health hacks for how to control that blood sugar, as well as some Eastern medical perspectives from both the Ayurvedic and the traditional Chinese medicine.
Thank you, Dr. Rosalie. So what is blood sugar? So blood sugar is something that we refer to when carbohydrate molecules end up in the blood in higher amounts. And this is something that we can test for diabetes monitoring and screening. So here you can see that you can have regular levels of glucose in the bloodstream, and then that is within our vascular system. And then you can also have excessive amounts of blood glucose in the bloodstream. And what can happen is that they tag onto red blood cells and can cause damage to small vessels, which are typically capillaries. And we'll go into the pathology of that in a moment, but this is just kind of an introduction to what we're talking about. So how is blood sugar regulated? When blood glucose is low in the fasting state, when it's been a while since we've had a meal, we have signals that are released to the pancreas, and then the pancreas releases glucagon, which is I remember it because it's like glucose be gone from the cells. And then the liver releases glucose into the blood, and that gives us the level of sugar that we need to function on a regular basis. And then on the other hand, when blood glucose gets high, that signals to the pancreas to release the insulin, which is the hormone that tells our cells to import glucose into the cells to use those sugars for energy. So insulin binds to a cell receptor on fat cells, on muscle cells, on many cells of the body. And then we get to a homeostasis between these two processes of glucose entering the cells and glucose leaving the cells. So why do we need carbohydrates? We have two main types of carbohydrates. Some are digestible. So those are our simple and complex carbs that we have in things like rice and quinoa, and also in things like honey and table sugar. So the most simple processed carbohydrate is found in things like sucrose. And then we've got indigestible fibers that are also carbohydrates, but they function very differently in our system, and they end up largely being food for our microbiome in our large intestine. But the ones that we are able to digest become food for our cells. So glucose is our muscles' favorite food, and it's also our brain's favorite food. So there has been this kind of demonization of carbohydrates in recent years, but we want to be careful about that because it's all about balance and and we do need some carbohydrates in our diet to be functioning healthy humans.
Thanks, Dr. Mary. So that's the basic physiology. Now we're going to hop into hormones and which hormones are involved in satiety and in appetite regulation and ultimately blood sugar regulation. So we've got a couple of funny names here: leptin, ghrelin, incretin, insulin, and adiponectin, and we will talk through all of those one by one. So our hungry hormones, this is a really exciting slide here. If you can follow with me through this, we start in the top right. We see our number one in red here. Number one is when hunger strikes, okay? And that ultimately is when we start to get signals from the body that we better fuel up. And essentially our first thing we crave are carbohydrates, okay? And ghrelin is the one that is involved in giving us these sensations of, oh, I'm hungry. The way I remember this is it's our little gremlin, okay? It's the one that will rear its head when we're extra hungry, okay? Number two here is after we've eaten, the stomach, there's receptors in the stomach that stretch out. There's mechanical receptors that say, okay, that's enough. We've sort of reached our satiety here. When that happens, we go down to number three, incretin gets secreted, all right? And that's the one that will tell us will tell basically the pancreas what to do next, okay? And to answer the question of the poll, the most important organ for blood sugar regulation is our pancreas, okay? Without our pancreas, we end up with type 1 diabetes ultimately, okay? And so the pancreas is the most important organ because it secretes insulin. Those beta cells in the pancreas secrete insulin. And when we look at insulin, it has far-reaching effects. It affects the brain, it affects the liver, it affects the muscles. It's basically the hormone that gets secreted into the blood when there is high blood sugar, that pulls that blood sugar out of the blood and puts it into our cells to store it. That's because high blood sugar in the blood is very inflammatory. Okay, so without a nice insulin response, we start to have high blood sugar symptoms and inflammation ensuing. Next up here is number 5, energy storage. I sort of touched on this. When the blood sugar enters into the muscles, that's what allows our ATP cycle to work, our mitochondria to feel fed, and energy essentially for all of our cells. Lastly, when we feel very full, our adipose cells, which are our fat cells, will store any excess sugar in the form of triglycerides. Maybe this is something you've seen in your blood labs. When we look at blood fats, we also look at something known as triglycerides. That's a sugar storage form that ends up in the fat cells. Lastly, these fat cells will secrete the hormone known as leptin, all right? And we want leptin to be low, okay? If leptin is high, it means there's too many fat cells ultimately. And so diving right into this really important hormone known as leptin, well, it's essentially what's known as an adipokine, which is a type of inflammatory cytokine or molecule that's secreted by those adipocytes, those fat cells. This is a lot of big words, but ultimately it's an important type of molecule because these levels decrease with the fasting state and increase after food intake, increase even higher with obesity. Okay, this is something we can check in the blood sugar to see where we're at in terms of how our fat cells, how are they responding to our diet, or the carbohydrates in our diet. If you look at the image just below, leptin ultimately suppresses our need and our want for food intake and promotes energy expenditure. Hence why if you're someone with obesity, we've got more leptin because we've got to diminish that food intake and increase our movement. Adiponectin is another really interesting molecule, okay? It's actually a protein secreted by those adipocytes, those fat cells, that levels will decrease with obesity, okay, and increase with weight loss. So it's sort of a little bit different than leptin. Adiponectin is a sign of a good insulin sensitive body. By being insulin sensitive, it means that when we see blood sugar, when we see sugar in the blood, we pump out insulin and it stores into our cells and it diminishes our chronic inflammation. Okay, so we want high levels of adiponectin.
Okay, so now we're going to get into insulin resistance. So this is when this whole process goes wrong. And as Dr. Rosalie was just mentioning, we want cells to be responsive to insulin. And what can happen over time when blood glucose is elevated for long periods of time, the cells stop responding. You know, they've responded many times to these triggering insulin receptors, and they start down regulating those receptors. So at this point, sugar does not exit the bloodstream and enter the cells. So we have this kind of displaced energy. It's not getting into where we need it to go for us to function, and it's accumulating in the bloodstream, which can cause problems. So this can lead to, there's also another kind of side path roller coaster that's happening here, where we have a high sugar or carb meal, and you have this drastic increase in blood sugar. Then the pancreas releases insulin and the blood sugar goes back down again. And this is all assuming that insulin resistance is not a problem at this point. So then the adrenal glands respond and release epinephrine. That's our stress hormone, our fight or flight hormone, and that can also increase our blood sugar. Over time, the adrenals can get exhausted by this repeated stress and release of epinephrine and cortisol and stop responding. And this is called reactive hypoglycemia. So we get more fatigue, more low energy, and less of that sort of stress response that we need to function in our day. This can often lead us to crave carbs when we're feeling tired and exhausted and like we can't get up enough energy to do what we need to do. So things like these lovely donuts on the bottom suddenly look really appealing. And then we have more sugar in our diet, more sugar in our bloodstream, and then over time, our cells become less responsive to insulin and stop importing as much glucose into the cells, so it's accumulating in the bloodstream. And this is what we can and then this can also lead to reactive hypoglycemia, where you don't have enough glucose in your cells to function. And over time, that can become type 2 diabetes. So now Dr. Rosalie is going to bring us to the next stage of our talk.
This next section has to do with diagnoses. So ultimately, you know, this talk is about blood sugar optimization and weight management. But the biggest piece here that I'm hoping we touch on is the preventative stuff, where we're starting to see the signs of early dysglycemia, which just means blood sugar dysregulation. And we can sort of prevent that with our 8 health hacks ultimately. That's where naturopathic medicine shines. But we also need to sort of make sure that we put our finger on the diagnoses as well, since it's really important with diabetes that we know which type we're dealing with, because the treatment strategies are very different. Let's go on to that next slide. So pre-diabetes, this is, you know, this is something that's totally reversible with diet and lifestyle. It is something that in naturopathic medicine, we catch it early, we identify it, and we make some huge changes. And I've seen, you know, my pre-diabetic patients return totally back to normal with simple diet and lifestyle changes. Pre-diabetes is made, the diagnosis is made either with 3 different things, okay? Either our hemoglobin A1C is elevated or our fasting blood sugar is elevated. And 2 have to be true, okay? We've got to see 2 of these things on 2 different occasions, ultimately. So hemoglobin A1C, if you don't know about it, it's basically a 3-month marker of our circulating blood sugars, okay? That's because it lives on a hemoglobin molecule, which is on our red blood cells. And when our red blood cells see sugar in the blood, they put up a little flag that says, I caught one, right? And so that's why the range there is 5.7 to 6.4%, which means that number of red blood cells have a little flag up, okay? If that number, if that percentage gets higher, we start to go into diabetes, etc. So pre-diabetes is the ideal time for prevention. Hemoglobin A1C is one of the really good ways to see how have you been eating these last 3 months. Another way to test is with fasting blood sugar. Okay, a morning blood sugar detection, and basically the fasting state. So you've fasted overnight because you've slept 8 to 10 hours, and then we check the blood to see where are we at in terms of levels. Okay, if we're above 120, that's when we start to think about, okay, we're in the pre-diabetic range. Ultimately, I like to see, or between 100 and 120, sorry, I like to see these numbers hanging out in the 90s or below, ultimately, in terms of optimal. So those are 2 ways we make those diagnoses. If we miss pre-diabetes, or it's hard to get the diet and lifestyle dialed in, we start to move into diabetes. Okay, that's the official diagnosis, where our fasting blood sugar there is over 140. So first thing in the morning with our 8 to 10 hour fast, our blood sugar is still high in the body. Okay, same thing with that hemoglobin A1C, we're above 6.5%. And then another 3rd way to diagnose diabetes is an oral glucose tolerance test, which is exactly what it sounds like. You take some glucose, and 2 hours later, we measure your blood. And if it continues to stay high, the blood sugar that is, then we can also make that diagnosis. There's several types of diabetes, okay? Dr. Mary will touch on those later. Type 1s are autoimmune type. Type 2 is the main scope of this talk, ultimately. It's the one that starts as prediabetes, over time turns into diabetes. Okay. And symptoms include increased urination, excess hunger, excess thirst. You just can't be satiated because essentially you're trying to thin out your blood so that there's not so much blood sugar floating around. If there's excess blood sugar, it leads to microvascular damage, okay? That's the interior lining of our blood vessels. Start to sort of get attacked by the blood sugar and get inflamed, okay? So since our blood vessels go everywhere, the biggest damage over time with this excess blood sugar has to do with vision. Okay, our retina needs a lot of circulation there, and if there's inflammation, our vision starts to go. Same thing with our kidneys. There are filtering organs for all of the blood. If there's inflammation there, they start to be damaged. And lastly, our skin, our biggest organ, which requires the most amount of blood all over, is we can start to see non-healing skin ulcers because there's just not enough circulation due to that microvascular damage. This next slide is sort of an overview of what I've just discussed. It's a good slide to refer back to later that just tells us how far this can go if we are unable to bring in that blood sugar, what the downstream effects are of essentially a diabetic state.
Okay. Now we're going to get into the nitty-gritty of what's different. What are the differences between type 1 and type 2 diabetes? So type 1 is an autoimmune condition, meaning that it is something where our own immune system is attacking another part of our body. In this case, it attacks the beta cells of the pancreas that produce insulin. Generally, we see the onset under the age of 40, and this is 10% of all diabetes, so it's a less common diagnosis. It tends to come on rapidly and happen in non-obese patients. And in this case, we lose our ability to create insulin. So these patients must have insulin on board. And that's the only way that they'll survive ultimately is by using insulin daily. And let's see. So in comparison, type 2 is a chronic inflammatory disease that comes on over time. The processes that we've been discussing generally pertain to type 2, so that blood sugar being elevated over time leading to insulin resistance. That's the pathology of type 2 diabetes. Typically, the onset is after the age of 40, although it can be in young children as well. And this comprises 90% of all diabetes. This tends to come on slowly, so there's a lot of time to monitor and screen your blood glucose and recognize prediabetes and take action. The need to use insulin is variable, so in some patients it is required and in some not. And let's see, and then ketoacidosis is a medical emergency that is more common in type 1 versus type 2 diabetes. So interestingly, type 1 diabetes is an autoimmune condition, and there's a lot that we don't understand about why and how it occurs. But if there's a genetic predisposition, so an infant has a family history of type 1 diabetes, there are a couple of things to pay attention to and try to avoid to set that individual up for their best chance of not developing type 1 diabetes. And one is avoiding essentially getting vaccinated for mumps and rubella, avoiding those viral infections. And then two is just really being careful about cytotoxins such as rat poison. And then there's also a couple of interesting pieces in terms of environmental protection. So breastfeeding for the first 6 months of life is found to be protective. This is largely because, as we'll discuss in the next slide, cow milk and specific proteins within cow milk can increase the risk of developing type 1 diabetes. And then vitamin D supplementation is a big one. And then avoiding cereal grains if there's a family history of celiac disease, because we often see type 1 diabetes go hand in hand with celiac and autoimmune thyroiditis. So this is what I was just referring to. There are a number of predisposing factors for type 1 diabetes, and one really interesting one is their gluten and also the beta casein in milk. Both have been shown to be increase a young person's risk for developing type 1 diabetes. And so again, these are really for people who have a family history of type 1 diabetes to kind of bring on these protective factors before it develops. All right. Next, we're getting into diabetes treatment. And so as you can imagine, these are two very different disease processes, and the etiologies are very different for type 1 and type 2 diabetes. So the way we treat them is very different. With type 1, when we catch it early on, one of the main things we do from a naturopathic perspective is immune regulation. So we want to prevent any further damage of the pancreas by our own immune system. And we can do that with largely through immune modulating herbal medicine and various immune modulating life supplement and lifestyle strategies. And then, of course, most will bring insulin on board. Then with type 2 diabetes, we're going to really spend most of our talk focusing on this. And our main goal here is blood sugar regulation. So we do this through diet and exercise, natural supplements, pharmaceuticals, and hormone balancing. So we mentioned before that there's a few other types of diabetes that can crop up. And so we were saying type 1 diabetes generally shows up in younger people. So that's that autoimmune condition. In the past few decades, there's a greater understanding that you can actually develop type 1, this autoimmune condition, later in life. So those are these first two diagnoses: maturity onset diabetes of the young and late onset diabetes in adults. And then we have gestational diabetes, which is a relatively common form. And this is why we screen at 24 to 28 weeks for pregnant people. And many of the treatments that we discuss in this PowerPoint are applicable to that state as well. All right, and then here we just want to briefly touch on metabolic syndrome. This is a condition in which we have systemic inflammation that's related to insulin. So this insulin resistance can elevate CRP, and as we were discussing before, can cause a lot of microvascular damage. So this increases our cardiovascular risk, increases our risk of hypertension. With obesity, we can secrete adipokines, which are a type of inflammatory cytokine that can further exacerbate systemic inflammation. And we see this kind of cluster of diagnoses start to form. And So we're going to touch on a number of these diagnoses as we go through our talk, and mainly really, so the key here is that we're focusing on blood sugar regulation, but it's important to have a holistic perspective with it. And so we're going to talk about anti-inflammatory measures, cardioprotective measures, and also kidney protective measures here.
Thank you, Dr. Mary. We'll move right along here. So we sort of talked through those diagnoses. There's a lot when it comes to diabetes. And like we were mentioning earlier, there is a lot we can do in the early stages of these diagnoses, in the pre-diabetes realm and in the very early diabetes realm. That's essentially where preventative medicine shines. And ultimately, I figure why most of you are here today is to talk through that stuff specifically. So let's talk next about how we measure blood sugar and the lab testing we do surrounding this. So as I mentioned earlier, the big tests are the fasting blood sugar. That's part of a panel known as a comprehensive metabolic panel, okay? Then there's our 3-month blood sugar marker, our hemoglobin A1C, and we can also do what's known as a point of care test in office, where we get our glucometer out, we prick the finger, and we see what the random blood sugar is, okay? All of the normals are there listed for your reference. We can also do some oral glucose tests, and this is what they do also in pregnancy, how they check for gestational diabetes. And then the big piece here is all of our related markers, okay? Not just our hormones that we talked about earlier, but checking insulin, actually. What is the insulin being secreted into the blood? And it's sort of downstream metabolite known as C-peptide, okay? This is sort of a next step workup when we start to see dysglycemia or blood sugar dysregulation. Okay, we test the insulin and its downstream effects. You can track your blood sugar at home. And sometimes I have patients do this even before they're diagnosed with diabetes, because sometimes I've got patients with reactive hypoglycemia or who are just generally curious, given their family history, what their blood sugar looks like throughout the day. Okay, is there a time during the day where it gets really elevated versus very low? Okay, it's something that we could prescribe, a glucometer. You pick it up at your local pharmacy. It's also something that's found online over the counter. It just involves a finger prick and getting a drop of blood, and it measures what your actual blood sugar is. Like I mentioned earlier, if we're fasting, the ideal is under 100. And if we're 2 hours after a meal, the ideal is definitely under 200, okay? Some of our diabetic patients, especially who are on medications, might start having symptoms related to blood sugar dysregulation before bed or in the middle of the night even. So this is especially important for diabetes type 1 patients. That's, the nitty gritty about the lab testing. We can move right into 8 health hacks now, the sort of the meat of the sandwich here of our talk. So health hack number 1, this is something that's really important, both societally, but also as a physician, is let's just talk for a second about weight optimization and what is a healthy weight ultimately. It's something that's been so steeped in social, political, personal, familial pressures that it's just worth trying to pull those things apart for a second. Essentially, weight optimization does not equal weight loss by any means. Health is found at every size, and we must celebrate human body diversity and strive to be body positive, okay? So ultimately, in this weight management talk, what I hope we portray is not the fact that we're trying to all lose weight here. We're just trying to gauge your healthy weight based on a couple of factors. Number one is our quantitative factors. Is the blood work within normal? Does it look nice and optimal ultimately? And number two, the qualitative factors, which you as the patient get to decide what those are. Do you feel like you have a body that offers you joy in movement and in being physically active? Right? That is health to me ultimately. And then do you feel like you've got a body that enhances your own unique self-expression? We are all so different with such diverse bodies. And this is just a concept that's of real importance here. If you're interested in diving more into sort of the peace movement that is fighting against the war against obesity, the peace movement that's a response to that is the Health at Every Size movement. And I've got the link there below.
Thank you, Dr. Rosalie. That's such an important point there. All right, so next we're going to look at some of those markers that can be helpful in determining your optimal weight and getting you to your own personal optimal health. So we want to look at any physiological obstacles that are in the way of blood sugar regulation and weight. So we want to look at the thyroid. That has a lot to do with our metabolism. If we're hyperthyroid, we're going to have a really high metabolism. And if we're hypothyroid, it's going to slow it down and leave us more predisposed to elevated blood sugar and elevated lipids. So getting that thyroid balance is an important one. Then next we have a lipid panel. So that's going to let us look at how our lipids are doing and how that relates to our cardiovascular health. We want to look at hormone imbalances. As we'll discuss in a little bit, our hormones can play a really big role in our insulin resistance and our blood sugar regulation. We'll look at inflammation markers. As I discussed before, the adipokines can be highly inflammatory, and insulin resistance is associated with an elevated C-reactive protein, which is a marker of inflammation. And then we want to look at anemia. If you're exhausted from having your iron too low and your red blood cells just aren't functioning properly, that's going to be a problem when it comes to increasing your exercise, when it comes to eating a healthy diet and not just craving sugar all the time. And then we also really want to look at musculoskeletal concerns. If you do have a bad hip or trouble with knee pain, is that keeping you from being able to get out and move and optimize your blood sugar in that way? Then we really need to address that through body work, through acupuncture, through a number of different means. So we have a great panel here that we put together in the last year, and it really addresses a lot of those things that I've already discussed. So looking at a complete blood count allows us to see if you're having any ongoing infections that are affecting your energy level. We can look at your red blood cells and see if you have any nutritional deficiencies based on that. The comprehensive metabolic panel allows us to look at your fasting glucose in addition to your liver and kidney function, which is a big part of that metabolic syndrome that I was discussing before. We can look at your TSH, which is a marker of how your thyroid is functioning. We can look at a lipid panel. Hemoglobin A1C is the main one that shows a more long-term picture of your blood glucose status that Dr. Rosalie mentioned before. CRP is that inflammatory marker. And then adiponectin is that one that it helps modulate our blood sugar levels and can get lower in the presence of obesity and diabetes. And then insulin, again, is very important, based as it's that main hormone that allows us to import glucose into our cells. So the next thing we can also check is our sex hormones. So there's a number of there's a number of ways in which our sex hormones can affect our glucose, our blood glucose optimization. And interestingly, PCOS, which is also known as polycystic ovarian syndrome, is a very common diagnosis in menstruating women, and it affects 6 to 12% of women who have periods. And it is it as a syndrome involves typically signs of high testosterone and also large ovaries, that kind of multiple cysts that form on ovaries, and often is seen with insulin resistance and elevated blood sugar. When it comes to menopause, diabetes can often present after menopause, and one of the factors here is estrogen is an insulin sensitizer. Once estrogen starts to decline, you're just at an increased risk of developing diabetes. And it's not that everyone who goes through menopause develops prediabetes or diabetes, but it's just a time period in which it's good to, one, look at your hormones and see what's happening, and two, just be extra cautious about your diet and lifestyle. And then there's also this lesser known hormone condition that happens with aging called andropause. And this is a decline in testosterone, typically seen in men. And this is also associated with diabetes, coronary artery disease, and heart failure. So here at Prosper, we really like to do salivary hormone testing. It is great because it looks at what's bioavailable in the tissues. What is found in the serum is much more variable, and you kind of just get a snapshot of what a person is having on either a diurnal, throughout the day or throughout the month when it comes to cycling females. And so for this, we get one sample of the sex hormones first thing in the morning. And then we often add on a cortisol test that tests 4 different samples. And that's a stress hormone that we'll discuss in a couple of slides here. But this is one way to just get a look at what your hormones are doing and see if we need to adjust your hormone status using diet, using herbal medicine, using exogenous hormones.
So our health hack number 3 is diet. This is one of my favorite topics with patients. If you've seen me, I always go there. But basically diet, like I said earlier, prediabetes is totally reversible with diet and lifestyle. So let's hop right into some of the nitty gritty here. If we could go to that next slide. So a diet that's supportive of preventing excess blood sugar and the microvascular inflammation that ensues is one that contains a good amount of protein. It can come from meat sources, but it could totally be a plant-based protein predominant diet as well. I've seen more luck with plant-based diets in this regard as well. But there's obviously a variable amount of proteins. One that is high in fats, but not the saturated fats, okay? The fats that come from vegetables and the fresh fats, okay? So I'm talking about using whole fat dairy or using avocados or fresh plant-based oils, not ones that have sat on the shelf for a while. The biggest piece dietarily is the carbohydrate one. essentially we've got to limit our carbohydrates. We're in this Western culture, you know, we have bread and toast for breakfast, we've got a sandwich for lunch, we eat chips for a snack, and then pasta for dinner. That we've got to flip that upside down ultimately, and limit our carbohydrate, boost our veggies. Okay, so carbohydrates, like Dr. Mary said, come in all sorts of different forms: simple carbs and complex carbs. The simple ones are, you know, very simple in that they taste very sweet. There are donuts, there are white bread. They are things that that basically the body doesn't have to spend much energy digesting. The complex carbs are found in things like sweet potatoes and nuts, and also whole grains. Basically, though they're paired with fiber. Okay, the nuts have a shell on the outside, or a film that we can eat. That is fibrous. That makes those carbohydrates not that causes them to have a lower glycemic index, which means that they spike the blood sugar less so. Okay, ultimately, all this to say, we've got to focus, if we are going to be eating grains, focus on the whole grains. And then if we are going to be eating carbohydrates at all, let's pair them with protein and fats. This makes it so that it's slower to digest, meaning that it spikes the blood sugar less quickly. Fresh fruit, much better than dried. And again, most additive sweeteners are going to be a no-no here. Again, we're flipping it upside down. We're removing the juices, the sodas. Alcohol is a biggie. Alcohol is a type of sugar, ultimately. If we're having 2 glasses of wine every night, we are upping our carbohydrate intake. And if we're trying to reverse dysglycemia, this is a big one that is often hard to figure out how do we pare down on. Like I mentioned earlier, in order to prevent that blood sugar spike, we've got to increase fiber. One of my favorite ways to do that is not with supplements, it's with vegetables. So I have a lot of my patients aim for 4 to 8 servings a day if they can do it. Ultimately, it depends on the pathology, what's going on with them and their symptoms. But fiber is found in our veggies. So ultimately, fiber prevents blood sugar spike, which is also known as the glycemic index. And the next slide will have that described. Glycemic index is something that if you get a chance after this talk, just Google it. Familiarize yourself with what it is, okay? It's basically a ruler with values from 0 to 100, 0 meaning we don't increase the blood sugar at all when we eat the food, and 100 meaning it's a simple carb and our blood sugar spikes. There's all sorts of foods that fit in different places along this ruler. High fat foods have a low glycemic index, just like high fiber foods, low glycemic index, which means that we're not spiking our blood sugar and we're having, instead of a roller coaster, a nice, even blood sugar distribution throughout the day. Another dietary tactic that I've seen really help with blood sugar control issues is a concept known as intermittent fasting. And it's essentially, there's a lot of different variable ways we can do an intermittent fast. Most all of us partake in some sort of intermittent fast because we finish dinner and we don't have a midnight snack, and the next meal we have is breakfast. Ultimately, the intermittent fast is how do we pull that fasting window on either end so that we are letting our organs rest, letting our blood sugar gently fall back into the normal ranges. So you'll see here, and definitely refer to this slide after the talk again so you can refamiliarize yourself. There's different strategies. Like I said, we can do a 16-hour fast overnight where we're not eating from 8 p.m. until noon the next day. And that's our 16-8 strategy. We can also do a 5-2 strategy where we have a regular meal and meal times for 5 days, and then 2 full days of fasting, or very low caloric intake. Alternate day fasting is another way to do this: 24 hours on, 24 hours off. Or lastly, our early time restricted feeding, which basically restricts your feeding window to a very short time frame.
All right. Next, we're going to get into the next health hack, which is exercise and movement. This is a really important one for mobilizing our blood sugar and then increasing our insulin sensitivity. So as you can see here, walking for 30 minutes a day, 5 days a week, along with moderate diet changes, can have your risk of type 2 diabetes. So this is really, when you're in that pre-diabetic range, this is very key. I also love this strategy. I jokingly refer to it as cakewalks. And it's just a way, a sort of practice that whereby you do an easy 10 to 30 minute walk after each meal. And the one that's the most important is dinner. So that's when, especially if you eat a late dinner, or you are eating, often people end up eating larger food because it's when they're home and are able to. That is a time when it's a really good idea to get your dog, get your partner, get a podcast going, and go for an easy walk. And it's going to affect your blood glucose in ways that even doing a long run earlier in the day won't necessarily. It's great to do some intense exercise throughout the day as well, but this is what we call a hack, where you're kind of adding something in that's not as difficult for you to do throughout your day, but makes a really big difference in your blood glucose. We also have strength training. So this is going to promote fat loss, but also just thinking about the fact that if you build your muscle mass, you're going to be burning more calories throughout the day. So when you get up to go to the bathroom, when you're just sitting in your chair, you're engaging those muscles more, and your muscles are actually just passively using more energy. So this is going to also improve your insulin sensitivity and lower your risk of metabolic syndrome. And your arms look great when they're muscly. And then we also have these smaller things you can do throughout the day, where you can get a standing desk instead of a sitting desk. It's going to often be better for your musculoskeletal system, and also you're engaging your core and your pelvic floor and your leg muscles as you're working. You can change your posture often. You can think about sitting on an exercise ball. That's another great way to engage your core and your pelvic floor while you're sitting. And then little things like parking farther away at the grocery store, taking the stairs instead of the elevator, just thinking about ways that you can move more. It's going to be great for your mental health and ultimately your blood sugar regulation as well.
Moving right along here to health hack number 5. So just to rehash the last 4, we talked about what actually is weight, a healthy weight. We talked about addressing the physiologic causes that might be barriers to weight loss and blood sugar management. We talked about diet, we talked about movement. Those are huge. So definitely start in that order. If we still have to hone things in, the next 3 hacks have to do with what's downstream when that other stuff is not working quite as well. So health hack number 5 has to do with stress management. And this is because cortisol is our stress hormone. Cortisol elevates blood sugar. Okay, so if we're chronically stressed, we have chronically high levels of blood sugar ultimately. It can also increase our blood pressure. So we're talking about predisposing ourselves to inflammation and metabolic syndrome here. So it's really important to navigate and mitigate that stress. Next slide, please. We've got a adrenal stress index test that we can do here. It's a salivary test, just like the hormones, because we have to get 4 samples. So instead of having you come back 4 times a day to have your blood drawn, let's just grab that data from a salivary sample. It's really important to check that first morning cortisol, the very first one when you wake up. That's the one that I like to see the highest, okay? Because that's our wake up hormone as well. And gently throughout the day, it follows this curve where it diminishes and gently gets lower and lower towards our bedtime. When it's low, it means our melatonin is high and helps us sleep, okay? If cortisol is all over the place, really high or really low, we know that the adrenals are affected. And without the adrenals functioning well, it's really hard to have it's hard to feel motivated and healthy and to have a good weight loss or weight management or even blood sugar regulation. So this is the next big thing I check in with my patients about.
All right. Next, we're going to talk about managing chronic inflammation. So with insulin resistance, as I mentioned before, we can often get this pro-inflammatory state, and this can increase our risk of heart attack, obesity, cancer, diabetes, many different things that it can be related to. And some of the common causes are chronic stress, hormone imbalances, and food sensitivities. So we've already discussed the stress piece, and we're going to discuss herbal strategies for that, the hormone imbalances, and food sensitivities is what we'll talk about right here. So the great thing about this is highly individualized. We're often saying avoid gluten and dairy, and we have our reasons for that, but it doesn't apply to everyone. It's just generally many more people tend to struggle with those foods. But the great thing here is we're actually looking at what's happening in your bloodstream that's specific to you. And what we're looking for in the food sensitivity testing is antibody production. So oftentimes what happens when you have a leaky gut type of picture where there's any damage to your gastrointestinal lining, this can lead to some of those proteins going into your bloodstream to places that they really shouldn't be and causing a reaction on a systemic level. So then your body creates antibodies to it. They've seen it before. They're ready to respond to it as if it's a pathogen. And then you end up having this inflammatory reaction every time you eat that food. And when we have allergic reactions, that's a much more clear version of an inflammatory reaction. If you get, that throat closing and you start sweating and all of that, that's an anaphylactic reaction. These are often on a more subtle level. So you'll wake up the next morning with a headache, or you'll have some just increased joint achiness, or you just feel more brain fog the next day. That's often the type of reaction you have with these, with this, what we call a food sensitivity. So this is one thing that you can look into testing to optimize your health and reduce your overall systemic inflammation.
And obviously there's a lot of good supplements for navigating chronic inflammation. Turmeric's our big one, and you're probably on some turmeric if you've come to see us. It's just a general overarching goal of naturopathic and preventative medicine is to diminish that chronic inflammation load. But if we're dealing with specific blood sugar regulation issues, it's worth checking your multivitamin to make sure there's these 3 specific nutrients in it: the biotin, the vitamin E and the zinc, okay? Biotin, as it says here, increases insulin sensitivity, right? And when we're insulin sensitive, it's the opposite of being insulin resistant. It means that we're pumping out enough insulin to bring the blood sugar out of the blood and into the cells. Okay, so make sure your multivitamin has some biotin. Vitamin E, again, sort of helps insulin do its job. It's a type of fat, all right? Make sure your vitamin E is in a tocopherol form. That's also important. It probably is if you're getting your supplements from us here, our physician grade varieties. And lastly, zinc is especially important for insulin metabolism. It also protects those beta cells, which if you think back in the earlier part of the slide set here, the beta cells are the cells of the pancreas that produces insulin, okay? When we do have complications from high blood sugar, when we are diabetic, these following supplements are what helps with those complications. So remember, diabetic ulcers was one of the things we talked about. Vitamin C helps with skin healing of those ulcers. B3 helps again with those beta cells of the pancreas. B6 helps against neuropathy, which is just that numbness and tingling in the extremities when the microvascular injury has happened in those far places of the body. B12 again helpful with neuropathy. Magnesium also helpful for glucose metabolism. All right, if glucose is too high in the sugar in the bloodstream, then we've got too much blood sugar. Lastly, flavonoids, we can get this from our diet, but we can also get it from a supplement if we need that boost. That prevents inflammation of the microvasculature, supports blood vessel health. And lastly, a type of fat known as alpha lipoic acid, there's really good studies on it helping with that diabetic neuropathy, that numbness and tingling in the extremities. Chromium is a big one, okay? Chromium is something that I reach for when it comes to nutraceuticals to help with basically insulin production and insulin sensitivity. It's a cofactor necessary for the insulin to be pumped out and the glucose to be pumped into the cells, okay? Improves that glucose tolerance, improves that insulin sensitivity, lowers in your need to pump out quite so much insulin ultimately. Make sure you're getting 200 micrograms a day of the picolinate form. And that last bullet has to do with the fact that chromium is especially depleted by a diet that's high in refined and simple carbohydrates, as well as a lack of exercise or movement.
All right, on to my favorite section, the herbal support. So here we're going to talk about a number of herbs that we can use to optimize our blood glucose. And first off, I'm going to highlight apple cider vinegar here. So apple cider vinegar and herbal bitters, which often come in combinations of bitter herbs that are in a tincture form, are really great ways to get your digestive system going before a meal. And that secretion of pancreatic enzymes are gonna allow you to better absorb and better break down your food and enhance your metabolism. So doing a little shot of apple cider vinegar a half an hour before a meal and then rinsing your mouth out afterwards afterwards just to prevent the erosion of your teeth enamel is a great way to get your metabolism going before each meal. All right, so on to the botanicals here. So there's a few here that are just really helpful in lowering blood sugar. So bitter melon is an Ayurvedic one that Dr. Rosalie will talk about that you can often use as a food to lower blood sugar. and fenugreek is in a similar category. And then Jemima is an interesting one because it actually blocks your sweet receptors and you don't taste sweet. So if you're willing to do that, if you have a sweet tooth and just want to make things less appealing, it's pretty wild. If you do a couple of drops in your tongue, suddenly chocolate just tastes really bland. Very interesting. One of our main things that we like to use is berberines, and these are compounds that are found in a number of roots of herbs, such as Oregon grape and a number of Chinese herbs, huanglian, huangbai. And these have been shown to lower glucose levels as well as lipid levels. So we often are using berberine extracts in a pill form for this reason. Some herbs that are great in preventing complications of diabetes are ginkgo and vaccinium. These are great for blood flow, so supporting your vessels. And astragalus is a great renal protective. It's also an immune modulator, so it's good for the type 1 diabetes picture, as well as reducing, just kind of modulating inflammation over time within the type 2 category. And it's known to protect your kidneys. So Dr. Rosalie was explaining before that your kidneys are the main organ that filters your blood. And if you have elevated blood glucose floating around, it can glom up those capillaries within your kidneys and lead to kidney damage over time. All right, so another category of herb is our adaptogenic herbs. I feel like we talk about them in every doc talk because they really do have wide-reaching effects on your health, and this is largely mediated through those stress pathways. In our society, stress is one of the major contributors to a lot of the chronic conditions that folks suffer from. And so in this category, we have a number of famous herbs, including Panax ginseng, that's our main Chinese ginseng. We've got Siberian ginseng, or Eleutherococcus sentacoccus, ashwagandha, rhodiola, and holy basil. And each of these have their different character, and we can use them for specific patients for specific reasons. So some are more stimulating, some are more relaxing. Panax ginseng, for instance, is very stimulating, and whereas Siberian ginseng and ashwagandha are helpful for stimulating your body, but are calming to the mind. And the same goes for holy basil as well. All right, so next Dr. Rosalie is going to talk about Ayurvedic medicine as it pertains to blood sugar regulation.
Thanks, Dr. Mary. So I know we're running over time here. We're just so passionate about this topic ultimately, but I understand if you've got to go, I totally understand this. This will be recorded if you've got to catch the last 5 minutes. But this is a really interesting section of the Doc Talk where we talk about Eastern medical perspectives. So from my perspective, since I studied Ayurvedic medicine, and from Dr. Mary's perspective, since she studied traditional Chinese medicine, it's something that's really unique to Prosper, is that we get sort of this Eastern perspective as well as the naturopathic one. So Ayurveda, if you're unfamiliar with it, it's the traditional medicine of India. It's Sanskrit for the science of life. Ultimately, how do you live your life is what Ayurveda means. And when it comes to type 2 diabetes and prediabetes, it's an excess in our kapha dosha. And kapha dosha is earth and water elements, all right? It's the heavy elements, and you've got excess weight, ultimately, energetically speaking. To treat that excess energetic weight, we've got to decrease the earth and water elements. We can do this from diet and lifestyle, and we also have to increase our metabolism, which is our agni, or our digestive fire, right? And then lastly, we've got to add in some fasting. So a lot of these are concepts we talked about earlier, especially with the intermittent fasting, or the cinnamon that helps with blood sugar regulation. That's the general idea. There's some really good Ayurvedic medicine for this. So in Ayurveda, the reason I chose to highlight type 2 diabetes rather than weight optimization is because weight isn't necessarily a topic that gets discussed in Eastern medicine. It's very much kind of a Western concept. When in Sanskrit, the word snigdha means oily. Okay, so if you have excess weight, you're excess oily as well. But what's amazing too is that snigdha also means love. So that excess oil also means you're wrapped up in some excess love, right? So it's just not quite the same. It's just not so much of a pathology, right? But when it comes to diabetes type 2, when we've got that excess kapha dosha, there's a lot of really wonderful herbs. Bitter melon is the one we mentioned earlier. Bitter foods in generally are going to diminish kapha. And if you find these melons in your Asian store, grocery store, definitely pick them up, roast them, find a way to bring these into your life. They're very bitter, but that is the medicine ultimately, okay? 2 melons a day juiced is something that in Ayurveda reverses diabetes ultimately. So they're very potent sort of food medicine. Gymnema or gurmar is that killer of sweet. It's something that also is hypoglycemic, meaning that that's the action. It diminishes blood sugar in the blood. So I have patients use this both on a daily basis, or if they need it because they're the type of person who can't stop at the one cookie, right? So I let them have the one cookie and then swish around the gymnema tincture. The next cookie doesn't taste as good. It's sort of a rescue remedy for that type of eating, if that's what's going on. And then fenugreek is another really big one in Indian foods. And 3.5 ounces daily is sort of our medicinal dose. You can make it in dal, you could put it in some sort of chapati pancakes. Get curious about these Ayurvedic herbs and try to add them into your daily life. When it comes to Ayurvedic diet, we've got to boost our Agni, our digestive fire. So make sure food is not bland and that it's well spiced. Additionally, we can add in some fasting. We can do it from the intermittent fasting perspective. We can also just eat 1 to 2 meals a day ultimately, or when we're hungry and only when we're hungry. And then lastly, diminish those kapha promoting foods, boost the vata promoting foods. Think about boosting dry, crunchy, bitter things, diminishing cold, wet, and heavy things. And then lastly, lifestyle things involve sleeping less, curiously enough. The more sleep we have, the more kapha we build, okay? So if you're able to just pull back on some of the hours of sleep, that is ultimately promoting a better metabolism. At least that's what Ayurveda says. And then lastly, heat up. So we've got to do some hot yoga. We've got to sweat when we exercise, get in the sauna, move that cold, wet, and heavy energy.
Okay, now on to traditional Chinese medicine. So in traditional Chinese medicine, similar to Ayurvedic medicine, type 2 diabetes was not as common as it is now. When calories were less available, when this medicine was being created, it was just not as big of a pathology, nor is weight loss as big of a focus in that medical tradition. But interestingly, they did have a syndrome called Charcot syndrome, and it was recognized in, a couple thousand years BCE as wasting and thirsting disease. So this syndrome describes what people were seeing, what practitioners at the time were seeing as people who had increased thirst, increased urination, and decreased weight. So this is kind of that pathology of full-blown either type 1 or type 2 diabetes. And it also, they talk about having the non-healing ulcers, as well as some of the other complications of diabetes. So it's interesting, they recognize it, they didn't really quite know what was going on, but they did have acupuncture and herbal medicine to address it. So there's a number of Chinese herbs that lower blood sugar and basically address different underlying patterns of dysfunction. But I'm going to focus on the qi deficiency side of it, and we're going to discuss the ginsengs because this is a really fascinating group of herbs. So these are all related botanically, and all of them, and from a Chinese medicine perspective, tonify qi. They generate fluids, so that kind of when you're losing a lot through your pee and you're constantly thirsty, this is addressing that syndrome. And they calm the shen and spirit and improve mental function. So from a Western medical perspective, we're often using them for cortisol regulation, to calm the mind, to modulate stress throughout someone's day, modulate those stress hormones. And all of these have been shown to be blood sugar lowering from a Western medical perspective. So these three shens or ginsengs are all in the ginseng category, but have really different qualities and are used differently. So ren shen, Panax ginseng, or red ginseng is the one that's really expensive and popular, and it's been used in Chinese medicine for many, many years. And it's kind of the wealthy person's ginseng in traditional Chinese culture. And it's very heating and very strongly tonifies qi and calms the shen or the mind. Then we have Shiyang Shen, which is American ginseng. This one actually grows in the United States, and it is a more cooling one that actually tonifies yin in addition to tonifying qi and generating fluids. And this also has an affinity for the lung, so often used with folks with lung pathologies. And then lastly, we have Dangshen, which is also known as Codonopsis. It's a lesser known ginseng, also known as the poor man's ginseng, because it's more prolific and cheaper than red ginseng. And it is a neutral herb, and it is widely used to promote digestion. And we say build blood. So by being able to absorb our nutrients, we're building kind of the nutritive substance, which is blood in traditional Chinese medicine. So in addition to herbal medicine, I also love using acupuncture for diabetic patients. And one of the things that it's really useful is a diabetic neuropathy. So this is when you have that numbness and tingling in your extremities. Often it's on the bottoms of people's feet and in their toes. And it can be caused from a number of things, not just diabetes. It can also be caused from cancer treatment and dysfunction in your low back, many things. But what we find is that electroacupuncture, where we insert needles at those areas and then provide a very mild electrical stimulation, this has been shown to reduce those symptoms over time. And I just love when I can get some change with people that have been experiencing that for a long time. We also use acupuncture largely for stress management. It's great for modulating the nervous system and helping with that cortisol release throughout the day as well, which, as we've discussed, is related to blood sugar.
Thanks, Dr. Mary, for that traditional Chinese perspective. That wraps up our doc talk here on weight optimization and blood sugar regulation. I just want to point out our November talk here on natural approaches to anxiety and depression. That's November 9th. Again, a really big topic for this time of year where seasonal affective disorder starts to hit. If you have any questions, feel free to write them in the chat, send us a message through the portal, give us a call. We are here to answer those questions. If you're interested in signing up for, some of the various blood tests we described or salivary tests, again, that's something you can talk with your specific physician about. We also have a online platform known as Well World. If you are interested in launching into a weight loss program, this is something that is online through Well World, where you can sign up and every day sort of track your progress, and you've got some supplements that are on board, and you've got some physician help, because we're there to sort of triage any questions that come up. If that's of interest to you, again, it's on our website. Feel free to call us and ask any questions, or we would love to see you and help you in your health journey ultimately.
All right, thank you everyone. It was lovely to see all of your faces and names here, and we will see you at Prosper soon. Bye.